Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 8:20 AM across Central Virginia, 1650 AM at Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we're pleased to welcome Chris Finley, HCA Healthcare Capital Division Associate Vice President of Community Engagement. He joins us for a conversation about his career and ongoing effort by HCA Virginia to support mental health and wellness among teens and more. So welcome, Chris. Thanks for being with us.
Thanks, Julia. Nice to be here.
Well, let's just dive right in. We like to start these conversations by getting to know our guests a bit better. We mentioned that you're Associate Vice President of Community Engagement with HCA Healthcare Capital Division in Richmond. Capital Division includes 18 hospitals across Virginia, Indiana, and New Hampshire. Your past experience includes roles with Lewis Gale Regional Health System based in the Salem area of Virginia and with the Smith Mountain Lake Regional Chamber of Commerce. Beyond those few details, what should people know about your work with HCA and your unique personal story, Chris?
Yeah, in my role, I oversee a division-wide community relations strategy. So this includes charitable investments, strategic partnerships, such as this education initiative we're going to speak to, as well as stakeholder engagement. Part of my role, it really involves also spearheading colleague engagement programs. So things like scholarship assistance, our employee relief fund, and all initiatives that are related to giving and volunteerism. It's a fairly new role for Capital Division. I've been in the position about 18 months now, but bring to the role about 30 years of industry experience in various marketing, PR, and community relations positions. Did transfer to Richmond from the Roanoke Valley region, where I was the marketing director for HCA-owned Lewis Gale Regional Health System, overseeing the marketing, PR, and communications for the 4 hospitals in Blacksburg, Lowmore, Salem, as well as in Pulaski.
Well, we appreciate you sharing that, Chris. HCA Healthcare, more broadly, is one of the nation's leading providers of healthcare services with 186 hospitals across 2,400 sites of care in 20 states and the United Kingdom. While HCA has an impressive footprint, its origins actually trace to the 1960s when co-founder Dr. Thomas Frist Sr. first established a hospital in Nashville based on his beliefs about quality of care and affordability. With that background, what are a few other facts or tidbits about HCA that people might be interested to know, Chris?
Yeah, Julian. So in addition to the EverFi partnership I'm going to share with you today, we are really supporting mental health and wellness in our local communities through a number of partnerships with a variety of organizations. And really in this role, we are trying to actively engage and serve as what we call an anchor institution in our communities. And through our strategic partnerships with our nonprofits and organizations throughout our footprint, we're really focused on community-based relationships. So I would like, for the listeners to take away, while this is a fairly new journey in my role and driving this initiative, we are open to pursuing partnerships where it strategically aligns to our impact areas.
And so let's talk a little bit about that partnership that you mentioned. HCA Virginia is collaborating on an innovative mental health and wellness initiative with EverFi, which is an international technology company. This partnership is focused on providing digital mental health education to middle and high school students across several regions in the Commonwealth where HCA has a footprint, including Central, Northern, and Southwest Virginia. For context on the importance of providing this education, we should note that the National Alliance on Mental Illness reports that 1 in 6 youths aged 6 through 17 experience a mental health disorder each year, and half of all mental health conditions begin by age 14. So with that background, Chris, Tell us about this partnership between HCA Virginia and EverFi and why it's meaningful.
Yeah, so beginning in the fall of 2021, HCA Virginia partnered with EverFi. And again, as you alluded to in our footprint, which is central, northern, and southwest Virginia, we have worked with our local school districts to provide students with education about mental health and wellness. And through this partnership, we have partnered with just at 18 school districts at no cost to the school or teachers. And over the last school year, so that would have been the 2023 to 2024 academic year, our impact reached over 12,000 students from 76 schools with just over 12,000 hours of learning as part of this partnership. So to kind of explain a little bit about the learning experience, it's targeted for grades 8 through 10th. And there's a total of 6 different digital lessons. And each one of those lessons or modules are about 15 minutes each. And they're really designed to provide a self-guided, interactive lesson to help students develop simple, actionable strategies. With that said, the program it provides real-world scenarios to prime students for long-term behavioral change using problem-solving and self-reflection activities. What's really slick about this program is it also provides detailed scoring reports, and each individual lesson comes with a pre and post assessment with real-time reporting. So this gives not only HCA Virginia, but the teachers real-time data to really measure the impact of the partnership. In general, we're really trying to take steps to give students building blocks to manage their mental health and wellness.
And the name of that course is Understanding Mental Wellness. And as you said, countless kids have participated. Thousands of hours of these modules have been completed, and it's equipping these students with tools that they can use now and in the future. What has the feedback been like so far, both from students who participated, perhaps, schools that are collaborating or are receiving these materials, and perhaps even the community? What's the response or the feedback been like?
The response has been overwhelmingly positive, Julian. Again, to date, we have just concluded our 3-year partnership initially with EverFi and have since extended that for a next term. And over the last 3 academic school years, just over 28,000 students from 153 schools completed over 30,000 hours of critical mental health education. In addition to the digital programming inside the classrooms, we have also been offering our teachers and schools the opportunity to organize in-person experiential learning opportunities where, for example, we partnered with Unity Reed High School in Manassas and offered 6 different expressive therapy trainings where students got to experience pet therapy or art therapy or music therapy, just to help give them mental health coping strategies and really trying to stay healthy in times of uncertainty. Again, we have been incredibly pleased with the partnership and look forward to continuing to bring this to our community.
And you mentioned that this partnership has been going on for 3 years and it's been extended for another school year. What else can you tell us about what the future of this collaboration might look like?
So again, we want this program to be designed to help equip students with knowledge and skills necessary to build, maintain, and promote positive mental health in themselves as well as their peers. As part of this role, what we're looking at is expanding the EverFi partnership to offer that not only in the middle and high schools, but also with other partners that we have relationships with. For example, Girl Scouts and Boys and Girls Clubs. So extending this digital programming beyond just the high school walls, but also in other nonprofit areas where we can extend our reach.
Well, it sounds like a solid foundation has already been built, and it sounds like there are plans for growth and expansion, which is positive. And it sounds like this is being received well and is potentially paying dividends in the future by equipping young people with more knowledge about mental wellness and, equipping them even with life skills about how to hopefully better manage their own mental well-being as the challenges and vicissitudes of life inevitably occur and crop up. So sounds like that's really important work that this partnership is doing and producing positive results. So appreciate you sharing all of that. Chris, we are just about done with this conversation, but before we let you go, we do have a tradition here on the podcast to ask each of our guests a pair of surprise questions. We have a list of 10 mystery questions from which you can draw. So if you would select two numbers between 1 and 10, I will give you those corresponding questions.
Sure. Let's go with lucky number 7 and 2.
Okay. And we'll do that in reverse order since 2 is first. 2 is, if you were stranded on a deserted island, what one book, one album, and one movie would you take to keep yourself occupied? We will spot you a copy of the religious text of your choice. So other than that, what are your 3 entertainment survival kit picks?
So from a book standpoint, I would probably lean towards Bounce. And that is a wonderful book that helps anyone who is experiencing change or times of uncertainty to come back stronger. So not letting defeat get the best of you. So again, bouncing forward and creating a path forward. As far as a movie, the Lord of the Rings or Hobbit trilogy would be preferred.
In the common tongue, it says, 1 ring to rule them all, 1 ring to find them, 1 ring to bring them all, and in the darkness find them. This is the 1 ring.
And what was the third, Julian?
An album.
An album. Rumors, Fleetwood Mac.
That's a classic, and the Lord of the Rings trilogy gives you lots of content to consume. So appreciate those selections there, and Bounce sounds like good information on resilience, which everyone needs. And then you also selected number 7. That is, if you could choose one superpower to have or any one skill to instantly master, what would it be and why?
I would say see in the future. So the opportunity to forecast what's ahead and how might I be able to leverage either myself personally or professionally to continue moving the needle in progress.
Absolutely. Foresight is always a good thing. Well, Chris, I want to thank you again for spending a few minutes with us and talking to us about this ongoing partnership with HCA Virginia and EverFi to provide instructional course material to students around Virginia in middle school and high school to help them better understand mental wellness. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Chris Finley from HCA Capital Division, for being with us today. So thank you.
Thanks, Julian.